Hey y'all, what is up? Lauren Duroy, DNP, APRN, coming back at you again, and we are going to dive in deep into something that many providers honestly never really utilize. As a matter of fact, I've never really spoken to somebody who really and truthfully utilizes this because it's really viewed as something that's very complex, overwhelming, and most people don't even touch it because of those things. So tonight we're going to talk about Cytochrome P450 system. This is really and truthfully essential for advanced practitioners to really understand, because once you understand how to kind of memorize the system, you're going to be able to recall this information on the tip of your tongue. You're not going to have to be looking things up in your Hippocrates or UpToDate or anything like that. You're going to already know it. You're going to already know which drugs can I prescribe based upon this patient's list or their diagnoses, those kind of things, and be able to recall it a lot faster. So I'm not only going to teach you some of these interactions today, I'm going to help you to where you can memorize them really quickly. Everybody that I've helped with this, they remember it almost instantly. I ask them days later, they remember it. So there is a portion of long-term memory that we have to kind of review things, but with these tricks, you're really and truthfully going to be able to put this on long-term memory a lot faster. And we all know that that is a huge part of decreasing our stress. The less that we can kind of backtrack in our professions as advanced practitioners is going to be essential for us. So short brief on what Cytochrome P450 system is. It's a system of our enzymes and the hemoprotein that allows us to metabolize drugs. And sometimes, depending upon whether you have other drugs in your system that are inducers or inhibitors of the substrates, which are the drugs that we're talking about, our target drug that we're talking about, the effects on the body, they're going to either enhance or decrease that substrate's drug's ability to interact with our body. So the first step that we're going to talk about is what is an inhibitor and what is an inducer, because that's the first thing that people really kind of mess up, and they get confused because to a lot of people, if you think of an inhibitor, it would seem like it would inhibit that drug, and really and truthfully, it's kind of opposite of that. So an inhibitor is a drug in our system that blocks. Okay, so I want you to think of whenever you're blocking something, I want you to think of somebody having their hand up and stopping that person from leaving. That is what an inhibitor does. It blocks or stops the metabolic activity of the enzymes. So this means that the concentration of our second drug, so if we have one drug A is an inhibitor to drug B, then that means drug B is going to build up in the concentration of the drug, and it can become toxic, or those effects can become exaggerated based upon that. We're going to learn about a few here, a few of the common ones here that can be a little bit dangerous. And that's what an inhibitor does. Okay, so it blocks or stops the metabolic activity of the second medication, the substrate. The inducers increase the metabolic activity of the cytochrome P450 enzymes. So that means that the drug is cleared faster from the body, so it usually becomes subtherapeutic. So the way I want you to think of inducers, so inhibitors, hand up, I'm stopping you from leaving the body. That's what an inhibitor is. An inducer, I want you to think of in labor, what are we doing? Induction, and if we're inducting labor, we are getting that baby out of our body, right? So that's induction. Whenever we're inducing labor, something is leaving, and that's exactly what an inducer does. Is it induces our body's ability to get that out of our body. So those are the difference in inhibitors and inducers. So let's talk about some really common ones, especially with warfarin, because warfarin's one of them that most of us have at least a few patients in our clientele that have to be on this medication, and we know that it is one of the, if not the, I should have checked that beforehand, but it is very, very high on the list. I know it used to be the number one drug for litigation. So we really want to kind of know that drug inside and out to help decrease our overall stress and help, of course, make sure that our patient outcomes are optimal. Okay, so the first thing that we're going to talk about is warfarin, and I'm going to talk about a few. So warfarin is a substrate of CYP450 2C19. Now there are different enzymes in this. Warfarin is a substrate of a few of them, but what we're going to talk about right now is 2C19. Okay, and what I want you to think of for warfarin, okay, so this is how we're going to associate and be able to remember this. And we're going to be able to just go through a few here because of the limitations that we have with doing the podcast and the time frames. But warfarin, I want you to think of an older lady holding an old-timey gun, okay? And this gun shoots out blood. So the more she shoots the gun, the more blood, okay? That is going to signify for us INR has gone up, okay? So if the INR is going up, then that means we have the other medication that is working in the body is an inhibitor, meaning that it is not allowing our body to clear itself of the warfarin. The INR is going up. Patients have increased risk for bleeding. That can obviously be very dangerous. The first medication that we're going to talk about that can do that to warfarin is amiodarone. So amiodarone is an inducer of the CYP450, 2C9, and also 2C19, which warfarin is a part of both of those. So the way that I want you to think of that, going back to warfarin, I told you we want to think of an older lady holding a gun, you can think of like an old-timey gun that we see like in Civil War or something like that, and it shoots blood because this is warfarin. And this older lady she has really good hearing. Okay, so you think of like older people, they don't have good hearing, but she has really good hearing. The first step in us being able to do this is it's going to kind of almost not make sense. It's going to be a little bit out there. That's what triggers our brain to remember stuff. If it's really bland, we're not going to remember it. So all of the tricks that I share with y'all are going to be, you're going to be like that. It's going to be a little bit quirky. It's going to be crazy, but it's going to stick in your head because it's so crazy. Okay, so warfarin's our old lady. She's holding this gun, and the more she shoots it, the more the INR goes up. So therefore we know that INR, the warfarin, is being blocked. Okay, so warfarin, I think of warfarin because of war. Okay, and so that's what makes me think of a gun. And then it's kind of an old school medication. Therefore, that's why I think of an old lady specifically holding that. We're going to be able to associate the other medications to something that we can relate that to. It has to be associable, relatable. It has to kind of make sense and have some kind of logical, illogical, if that makes sense, flow. Illogical meaning that it kind of stands out a little bit crazy, but logical in that it'll trigger you that, oh, what was that? That's right, warfarin, war, I think of gun, it's an old school medication, so it's, kind of granny holding a gun, okay? And that's kind of out there crazy, like, why would you ever see that happen? That is not something that usually happens, the grandma that's, real vicarious like that, or a little bit cantankerous or anything like that was gonna stick in your mind, correct? More so than the sweet granny making cookies. Okay, so warfarin, that's our first medication. Now, whenever we have that in our system and we introduce something like amiodarone, and I want you to think of a drone. So amiodarone, that's a drone, is one of those electronic devices that fly, like a little bitty, like a remote control plane is a drone. If you're not familiar with it, you could Google it. But they kind of fly and they make a noise. Okay, so amiodarone, we've used that in the past before, so it's important whenever we're doing these things that we have a consistency. For some of the other tricks that I've taught you, like with ALS, amiodarone was a drone. Okay, that's why I'm also talking about this interaction specifically. So amiodarone comes along, but Granny isn't our typical Granny, obviously, correct? She has really good hearing. She hears that amiodarone, that drone coming, and she starts shooting at it. Okay, so we have increased blood, we have increased shooting. That means that our INR is going up. If our INR is going up, that means that Coumadin is staying in our body, correct? It's kind of building up. It's increasing risk for toxicity. It's not being eliminated quickly or metabolized as quickly. So it's building up. So we know that amiodarone is an inhibitor for warfarin. So we need to be cautious of that combination because it can do that to our patients. So especially if it's something that they've been stable, then we introduce the amiodarone, okay, increased risk for bleeding. So we want to think about that. Now let's do another one. This is a little bit be different. Let's do one that's opposite now. And warfarin, we still have Granny, right? She's holding her gun. But now instead we're going to introduce rifampin. Now rifampin, what I think of, and I want you to know that in making these up, you can change it up yourself however it works for you. So the things and the tricks that I use may not work perfect for you, but my main goal here is to teach you how to do this so you can apply it in your own practice so you can remember these things just like that. Okay, so rifampin, I think of riff, like a guitar riff is whenever, guitar has a solo or something along those lines, then it's a guitar riff. Ampin, I think of an amp. Okay, so it makes the guitar sound really loud. That's what an amp is for. So that's rifampin. So rifampin, I think of somebody holding guitar and just really jamming out really loud with the amp. That's what I think of rifampin. Now, if you remember, our Coumadin Granny has really good hearing, right? She has an old school timey gun that shoots blood instead of bullets, and she has really good hearing. So whenever we see rifampin, whenever we increase rifampin, she's gonna drop her gun and cover her ears because it's too loud. And we know that grannies don't like loud, crazy music anyhow. So what she does is she drops her gun, she covers her ears. So that's the thing, is I want you to literally be visually thinking about these things, because you can think, well, what happened when those two interacted? What was it that happened? Because if you try to just remember increase INR, decrease INR, increase INR, decrease INR, it's going to just all blur together. If you have a storyline there, if you have something to back it up, you're going to remember this for probably ever. So that's why it's important to do this. So rifampin and warfarin means that the INR goes down, correct? She dropped her blood shooting gun. Okay, so their warfarin granny dropped her blood shooting gun. It landed down, so she can't shoot it anymore because it's laying on the ground. She's covering both of her ears up with her hands, and the INR is going to go down. So that means that rifampin, because the INR went down, I know from that logic that rifampin is an inducer of it. It induced the body's ability to get rid of the warfarin. Okay, so let's go on to, I have a handful of them that I could teach you for warfarin, even diflucan. There's tons of them, but let's talk about caffeine, because that's something that a lot of people, you're going to see this a lot with individuals. Most people drink probably too much caffeine, so that's something we want to kind of talk about here. And then I think it's going to actually kind of conclude what we can talk about in our discussion today. But so caffeine is a substrate for the cytochrome P450, 2C9 and 2C19. And ciprofloxacin is an inhibitor of it. Okay, so caffeine, just think of caffeine itself. Coffee, you know what coffee does for you. That's what I think of. I think of caffeine, cup of coffee. That's what I think of. Ciprofloxacin, I'm going to think of an ox. So ciprofloxacin, a mnemonic that many of us use going through school, was strong as an ox, because ciprofloxacin is one of our stronger antibiotics, and we have the word ox in it. So I think of an ox sipping something. When I think of ciprofloxacin, I need to make it a little specific to this medication, because it's not all fluoroquinolones. It is specifically ciprofloxacin that we're talking about here. So I think of an ox, but for ciprofloxacin, I think of an ox sipping something. Now, whenever the ox sips the caffeine, it gets really hyper. Okay, so I have a cute thing that'll kind of show you on the show notes. I won't be able to show the animation with it because of the limitations of a podcast. In the show notes I could show you on this, but I have an ox kind of jumping around and going crazy, and that's what I want you to think of. So what happened whenever the ox sipped, instead of water, it's sipping the caffeine, it got really hyper. So that tells me that the caffeine is kind of building up in the body. It's having more of an effect. So that tells me that Cipro would it be an inducer or an inhibitor? It would be an inhibitor, correct. So because it's actually stopping, an inhibitor stops that from leaving. So ciprofloxacin is an inhibitor to caffeine. And that's how you're going to be able to memorize that. So I also want you to think about, maybe over the next few sessions, we'll talk about a few others. Cigarettes can be inducers to a lot of different medications that can make a big difference in your patient's overall response to medications, especially antipsychotics, antidepressants, anti-anxiety medication. And that's a really important one that we're going to tackle on our next one, because I kind of want to spend a little more time specifically with those only, because how often do you see that combination where people who suffer from anxiety and depression also smoke? So that could be one of the reasons why you are not getting near the result that you would think that you're getting, or that you're seeing really labile results, because someone may smoke more or smoke less, and that's going to change the effects that it has on the cytochrome P450 system. So that's super interesting information. I hope that was helpful to you all. I'm going to show you some show notes on this. And next time around, we're going to talk about cigarettes and how that's could be affecting your patients' outcomes because of that. So it's interesting medical information, and I try to make it a point to be brief on here, so we're not jamming a whole bunch of information in, but we're able to really learn in a structured way. So y'all have a great day. Thank you so much for tuning in, and I'll see you later.